Rwanda say they are not worried about the country's readiness to open airports and places of worship, as all of this will be done according to the COVID-19 prevention guidelines. The health authorities say this as the number of people infected with the pandemic continues to rise. As we have seen from the beginning of last month, the number of COVID-19 infections has risen from about 400 to about 1,200 infections. On the other hand, the number of people who have recovered from this pandemic has also doubled from more than 250 to almost 600, including the 44 who were recently discharged in one day. In an exclusive interview with RBA on Tuesday, Dr. Sabin Nsanzimana said the pandemic is especially flattening in Rusizi district, which he said was promising that the district might be taken out of lockdown soon. Our colleague Divin Uwayo sat down with the Director General of the Rwanda Biomedical Centre, and this is what they discussed.
The increase in numbers can be explained by different factors. Number one is that people are no longer in lockdown, so they're moving. And they're moving with the presence of virus. So the likelihood that they can move from virus from one place to the other is no longer comparable to before, when everyone was still at their homes. Number two, the number of tests performed per day has increased from 200, around 200 to 400 in March 2020 to about 4,000 today. So the more tests you perform, the more likelihood that you get more positives. In addition, there's also regional changes of the COVID situation. We've seen the truck drivers movement with COVID since beginning of May until today. We see a lot of positive cases among truck drivers who are moving in the region. These numbers also have contributed to the positive cases I've been seeing. And there's a recent case of one district bordering DRC, Rusizi district, where we saw an increase of cases and transmissions cross-border, but also within the four sectors that are currently under lockdown.
Let's talk about Rusizi district. How do you analyze the disease in the specific district?
Well, Rusizi district is a very interesting case on how we can detect something and respond with all the means the government have put in place by first lock it down on time and appropriately, and identify the positive and transmissions, and also control the cross-border movements before it crosses to other districts.
And we no longer see an increase of the new cases in Rusizi district.
True, yeah. We're seeing a positive trend in containing the outbreak in Rusizi, and we hope that it will continue that way, and then the lessons learned from Rusizi can be applied wherever a similar case happens, and also how we can stop that situation to happen by doing surveys and testing and isolating contacts everywhere we see or we detect or we feel like something could happen. This is what we are doing in Kigali currently.
According to your analysis of the pandemic in the Rusizi district, everyone can wonder when Rusizi will be no longer in lockdown.
Of course, there are several factors, and there's different stakeholders who will be contributing to this kind of decisions. But what I was saying is what I've seen on ground from before and today. The four villages under lockdown are doing differently. One village has captured my interest and my attention, which is Ngombo, Ngombo sector. Before, it was the one that are not doing well with compliance to the measures of lockdown. But after with involvement, engagement of the leaders within the sector and within the district, Ngombo is doing far better than other sectors. Of course, the trend has reduced generally, but there are differences in how you appreciate that. And I think these are numbers, these are appreciation, these are analysis that will guide the decisions forward about Rusizi.
And the government of Rwanda recently announced that the sky of the country will be opened to international travelers. How are you ready to deal with the pandemic?
Travels can bring infections, but people need to move. But people need to move without diseases. That's why there's a gradual opening of some activities like flights, probably borders as we continue to observe the situation. But the most important thing is how everyone contribute to not spreading the virus by wearing masks properly, by keeping social distance, by washing hands frequently. And people actually could move without transmitting the virus if they all comply to the three things: mask, washing hands, and keeping social distance. And they could move from one country to the other by just abiding to those measures. But unfortunately, there are few who don't adhere, then they keep spreading the virus. So it's a daily, it's a weekly, it's an exercise that it keeps changing, and actually decision can change anytime, being opening or closing, or being monitoring or half balance. Every single day numbers change. We are all waiting during the day we are all watching what is going to happen with the testing that are being done today. Then overnight, stakeholders, leadership can make a decision accordingly. So it's not that a communique or a decision has been made yesterday that it's going to change what will happen tomorrow. What changes what will happen tomorrow is what we see today.